All right, hello. Sorry for the late start tonight, guys, but I made it. I have not really been able to get it together today. I've been kind of like unfocused, not getting things done the way I want to. It's just happening. I am in my follicular phase, which usually you have really good energy, but I seem to have like a big dip in it like midway through. So I don't know. Hopefully tomorrow I'll be bouncing back. But today's been rough, and so hence why I lost track of time. I was a little bit late starting this live tonight, but um, welcome. I do bi-weekly live Q&As and all things pelvic health and period health. They're usually on Monday nights, but I couldn't last night, so it is tonight. It is Tuesday, May 3rd, and I'm very excited to get into it this week. Okay, so if you are joining me live, I'm going to write a comment to please drop your questions on all things pelvic and I'm sorry, how you spell pelvic and period. All right, and if you're watching the replay, you can still drop a comment, and I will try to answer your questions on a future live. So today I wanted to talk a little bit about the role of a physical therapist during pregnancy and postpartum. So it may be somewhat obvious, but a lot of people ask me what exactly we do for a pregnant woman. So it may be as simple as you are someone who is pregnant and you are experiencing musculoskeletal pain. And so, just as you would if you weren't pregnant, you seek treatment from a physical therapist. So, this could be low back pain, pelvic girdle pain, it could be shoulder pain, ankle pain, it could be any pain. If you want someone who is specially trained to work with someone who is pregnant, who knows what to take into consideration and different things that come into play, you can always seek treatment from a pelvic floor physical therapist. However, we also do a lot during pregnancy to help optimize your body during this time, to help you maintain an exercise routine during this time if you aren't sure how, because there are a lot of different things to take into consideration. And then we can also help you prepare your body for labor, okay, and delivery, and even prepare for that postpartum period. There's nothing like an early start. So we can help by educating you on all things about your pregnancy, about delivery, different options that you have, what to expect in the postpartum period. And that is a great place to start. Education empowers us, okay? So the more that you know during and going into something, the better you're going to be when you're there, okay? So that's one way we can help. Another way is we bring soft tissue and manual therapy to the table. So we're specially trained to do more than massage, okay? We can do joint mobilization techniques if they're warranted. We can do different manual therapies. So these could be massage, but they could also be things like cupping or dry needling. As long as your provider, your OB, or your midwife is okay with that, we will perform that if that is something that we feel will help you in this time. We can also train you and your partner to perform perineal massage as you near your delivery date. We can help you think and try out different birthing positions and see, maybe you need a little bit more hip mobility to be comfortable in that position, to see if you're able to relax your pelvic floor in that position. Try different things out, see what works, and see how we can improve your mobility so that you are most comfortable during labor if you want to try different positions. And then exercise, right? So exercise is important to continue throughout your pregnancy, but you're not going to be able to continue at the level that you were at before. And for some people, it's really hard to take that step back and slow down and still know what to do and keep on a routine, understand how to listen to their body and not push it too far, and understand what things to bring into consideration when choosing exercises. And so we're specially trained to help guide you through those changes and adapt your exercise program throughout each trimester of your pregnancy. And then we are definitely specially trained to do postpartum, but we'll get there. So let's see, I talked about positions, I talked about, let me check my little notes here. Oh, obviously, God, I'm missing like the most important one. It's always the obvious one you forget, right? And that is finding a connection with your pelvic floor. Okay, so this is like a pelvic floor physical therapist bread and butter, right? Is teaching you to connect with your pelvic floor, to be able to understand when you are relaxing your pelvic floor, when you are contracting, and when you are bulging your pelvic floor. Okay, so it has a big range of motion, and we want to know that you're able to access and control it during pregnancy, and especially during labor, and even bringing that into postpartum. It's important in all three phases, okay? It's important during pregnancy because it can help you maintain comfort. It can help you keep that pelvic floor relaxed, which can help with muscle tension in other parts around the pelvic floor, like the hips or the low back. It can help you avoid things like leakage during pregnancy as best we can. It can set you up for success with recovery of diastasis recti, and you'll bring that better connection to your pelvic floor into labor with you. So you'll be able to relax your pelvic floor, which is especially important if you are planning to have a natural birth or a birth without an epidural. You want to know how to relax that pelvic floor and know that it's relaxed and know how to get it there, because that will help you have a smoother and easier labor process, especially when combined with the other things like manual therapies that we can work on. This is especially important with breath work, okay? Our breath goes hand in hand with our pelvic floor. It's all part of the greater core system, okay? So you want to connect not just with the pelvic floor, but with the whole core, okay? So learning how to control your breath with your pelvic floor, your core, will help with all these things. Will help prenatally, will help during labor, and then bringing that awareness and understanding into the postpartum period, your fourth trimester, right, is only going to set you up for success, because finding that connection again can be difficult, especially if you never found it in the first place, right? So bringing that connection with your pelvic floor is going to help you recover from diastasis recti. It's going to help you return to your prior level of exercise in a more efficient manner. It's going to help you avoid things like leakage and pain and dysfunction postpartum, okay? So finding that connection while you're pregnant is very, very important. And that is the biggest thing that we bring to the table that other providers do not. No other providers are trained to assess the pelvic floor and its strength and its tension and train you how to find that connection and make it work in your favor, right? So there's a lot that we can do to work on preparing for your delivery and all that. The manual therapy, the exercise, connection with your core and pelvic floor, and breath work, position training. We can even do things, there's different manual techniques and things to help with fetal position, so that can help make an easier labor for sure. And of course, we're good first line to screen and send you out for referrals to other providers if we feel like they're warranted, because we spend a lot of time with you when we meet. We spend an hour together, maybe once a week, maybe a little less than that. Just depends. And then moving into postpartum, our role postpartum, the biggest way that we have a role is to return you to exercise and normal activity, okay? So if you want to be able to get back to running or weightlifting, or even just walking around comfortably and being able to hold your baby comfortably, we can help with that, okay? We don't want to push it too fast, and so we also play a role with helping you with your mindset, because it can be really hard postpartum to keep yourself from jumping right back into things before you really should be doing them. And we can be a first line to screen your pelvic floor and everything postpartum to make sure you're on track, let you know what's up, make sure we're catching something early if there is something to catch, and preventing any further disruption. So diastasis recti is a big one postpartum. For many people, it spontaneously resolves, but there are about 33% for whom it doesn't, okay? And sometimes if you start pushing the abdominal exercise too early, you can actually make that diastasis worse or make your chances of recovering even less. Okay, so it's very important for that. If you're experiencing leakage postpartum, if you're experiencing pain with sex or just any pelvic pain whatsoever, more than you should be. Obviously, you're going to be in pain no matter what for a little bit afterward, but if it's going on too long or it's a different type of pain that's more persistent, that's where we come in. Or maybe you're still having other musculoskeletal pain since pregnancy. You still have nagging low back pain or hip pain or who knows, anything that's going on. We are trained to progress you out of that postpartum period without going too fast. If you go to a non-pelvic floor trained provider within the early, couple months, or even within the first 6 months postpartum for back pain or something, they're not going to understand where you should be at with exercise at that point. Only a pelvic floor therapist will. And yeah, of course, we bring that manual side to the table with all of that too. If you're having muscle tension or things that need some soft tissue work and love. What am I missing? Gosh. And yeah, finding that connection, right? Again, finding that connection with your core, your pelvic floor, your breath, all those things. Postpartum is so important. We can help catch and treat prolapse too. That could be a big issue. So it just depends. And I encourage every woman, whether you deliver vaginally, by C-section, VBAC, anything, get screened by a pelvic floor physical therapist postpartum, okay? And especially if you're itching to do something before that 6-week mark, come see us. We can give you really nice, gentle things. We can start that education process, start that retraining of the pelvic floor and core and breath before you hit that 6-week period. Honestly, no one should be jumping right back into things, even if their doctor clears them at 6 weeks. That doesn't mean that you should go run a mile that night. Okay, it doesn't. You might not be running a mile for a couple months. Okay, it's hard. It's hard because you feel okay, so you're like, oh, I can do it, but you shouldn't. You had a major trauma to your body, maybe a major surgery if you had a C-section. You need to give your body time to heal and recover because there's more going on than it appears at the surface, okay? So give your body time. Use that time postpartum to get used to your new schedule, get used to your new body, feel what you're feeling, and just roll with it, Don't be hard on yourself. Let yourself look like you just had a baby. That's fine. That's totally fine. Okay, don't suck in your stomach. Let it all hang out and come see a pelvic floor physical therapist, and we can help get you back to where you want to be. And that includes assessing how things have changed, right? Okay, maybe getting back to where you were is not possible. Maybe you can get better, or maybe there are things that we have to consider that we didn't have to before, okay? So we'll talk about it all together. And I mean, we might be screening your posture. Maybe you're having pain when you're holding the baby or when you're breastfeeding or nursing. We can help you find better positions, help you work and train your posture so that you are strongest when you're holding the baby. You're not holding the baby in a posture that is bad for you, for lack of a better word. A lot of people tend to kind of rest back in their back extension, rest on their hips and hold the baby, using their body to hold them. That's not great for your back. You might be squeezing your glutes. You're resting in an anterior tilt all the time. It's rough. And part of that is because there's a lot of weakness there. So it's hard to engage things. The other thing a lot of people do is hold the baby here. They start to get shoulder pain, neck pain, or they're always hunching forward looking at baby, especially if they're nursing. And they start to, look like this all the time. So there's lots of things postpartum. It doesn't have to just be to return to a high intensity exercise or something. It may just be to return to a functional normal for you, okay? Whether that's being able to walk around the stores, without getting sore pain, or having a lot of discomfort, or Maybe it's just retraining that posture or optimizing your posture and strength for this postpartum period, and minimizing dysfunctions like leakage, like painless sex, like chronic pelvic pain, like low back pain, like hip pain, anything. It might be ankle pain for all we know. Posture can do crazy things to our body. So there's a big role for pelvic floor physical therapists, basically. And I highly, highly, highly recommend seeking pelvic floor physical therapy, or at least a doula or someone that you can sit down with and talk through all of your options, talk through all of your concerns. They can help you with breath work and things too if you aren't able to get to a pelvic floor therapist. But like I said, pelvic floor therapists will bring that extra level to the table, that internal examination of the pelvic floor musculature and that connection, building that connection with your pelvic floor, your core, and your breathing all together to go into labor as strong as you possibly can and as ready as you possibly can. And then I definitely 100% recommend every woman get a pelvic floor assessment with pelvic floor physical therapist postpartum, even if it's just a one-off screen and you're good, or continue with treatment, because most people probably need it, at least a few sessions. So let me know if you have questions. I'm so excited that I am heading in this direction, focusing more on my pre- and postpartum clients, because these have really been my dream client base for so long, and now I really feel ready to head that direction, and I can't wait to talk with expecting mamas and work with postpartum mamas, new mamas. For those of you who don't know me, I live in Orlando and I treat in-home physical therapy. So I'm a mobile clinic. I don't have a clinic space. I come to you, treat you in your homes. You don't have to get a babysitter, now that you've had a baby. And do all things pelvic floor physical therapy. So if you are interested in working with me, you can send me a DM on any of my social media. I'm at the Virgo_PT on Instagram and TikTok. You can drop a comment here. You can follow the links on my channel to my website, and schedule. I have free discovery calls, so it's just set up a call, video call, or on the phone. Just chat about what I do and see if it's what you're looking for, and get you on the schedule, and so we can start working together. I also have a free webinar next week. I believe it is on the I believe it's on the 12th. Okay, live on YouTube here, all about diastasis recti. Okay, so definitely check that out. Free webinar about diastasis recti. So if you're pregnant or postpartum and think you have diastasis recti, definitely check it out. And we will talk more about it there. So that's on the 12th. So you can watch it live, or the replay will be posted on my channel afterwards. All right, guys. Thank you so much. Have a good night. And I can't wait to treat your pelvic floors. Bye.